hi. Please take a seat. You're here for your checkup, is that correct? Okay. So, did you fill the forms in on reception? You did. Okay, so if we just give it a second, they should come through. All your information records should come through on my tablet. It can take a little while sometimes. Yes, technology is wonderful, but sometimes it can be a pain as well. Right, okay, so let me just see. And your first name is Sarah, and your surname? Yes, and your address, please, because we do have more than one Sarah. Right, yes, okay, that's fine, yes. So your information says that you're here for a checkup, but you're having some problems on your lower right. Is that correct? Okay. Well, I can certainly have a look at that for you. So we don't need this anymore. We'll put it to one side. So if you'd like to take a seat and lean back for me now, please, as far as you can. That's better. Okay. So I just want you to open your mouth wide. First of all, I'm just going to be using this mirror just to have a little look around, so nothing to worry about at all. Okay, so just open your mouth as wide as you can and I'll take a little look. Okay, so far everything is looking, just go down the bottom, looking quite good. And your problem was on your right, is that correct? Okay, so I can't see anything really bad going on at the moment. Let me just put my gloves on so I can get a closer look and see if we can figure out what's going on. Is that okay? Right. Yes, it can be problematic sometimes to get on these gloves, but I'm sure we'll manage. There we go. Okay. Right, now I'm just going to come up close to you if you don't mind. And first of all, I'm just going to be touching around your cheeks and your jaw. Okay, is that okay? Let me just get my hair back out of the way. I don't think you want my hair dangling in your face at all, do you? So, yeah, just gonna go around your jaw, down your neck, and just feel. And you tell me if there's anything tender at all, okay? So, just gonna feel around. Does that hurt at all? No, okay. I'm just gonna do the same on the other side, okay? I'm just gonna have a little feel around. Anything? Any pain? No. Sorry, just so if you just clench your teeth together for me, and I will feel around again. And then I'd like you just to open and close your mouth a few times, just so I can feel around the top joint of the jaw, because some of our patients have clicky jaws, which I also have myself, which is nothing you can do about it, and it doesn't really get problematic. Sometimes I recommend to take some cod liver oils or certain oils so that it keeps well lubricated and in later life doesn't cause a problem. Okay, so just clench your teeth together for me and I'll go and do the same thing. Okay, that's it, just clench together, and the same on this side. So is that hurts by there? Right, okay, and now I'm just going to go up the side and do like I said and push on the top of your jaw joints. Okay, so again, tell me if this hurts and I will stop. Same this side. everything seems to be in good order so far with that. So I'm just going to take another look, and I'm going to be using this little tool here. Again, nothing to worry about. I'm just going to go along each tooth and tap, okay, and see if there is any pain or anything that shouldn't be happening that's happening. Okay, so just open your mouth wide, and if you need a little break, just put your hand up and I'll give you a second, okay? But this shouldn't take too long at all, so open as wide as you can. That's it. I'm just going to use this at the same time, so I'm just going to be tapping and looking. Okay. By there? Hurts by there? Okay. I'm just going to slightly turn it at a different angle. Yeah, that hurts. Alright, okay. I'm going to go around the top as well. Same thing, just gently tapping and looking, okay? Just hold it like that. There we go. Any pain at all? No? Let's go slightly into this side. And no pain at the top row. Okay, well, your teeth are looking really healthy. Apart from that one, that lower tooth. So I'll have a look into it. It may be that your filling has got a little crack in it or something. So I'm just gonna wait. When was the last time you had x-rays done? A little while back. Okay, so we may have to do a couple of x-rays for you just to see what is going on in your mouth. So I'll go and get that set up for you, and I'll be right back to sort that out for you, okay? Okay, so I'm back and I've got what I need. I'm just going to pop my glove back on, okay? And you are actually the first person to try this. All it is, you're going to put your mouth, and open your mouth and bite down on this, okay? And then I'm going to press the side, and all it'll do is take a picture, okay? Okay, so let me come back closer to you again, and you can open your mouth wide. Yes, don't worry about that. That's special medicine on there. Well, not quite medicine, but it's special stuff that helps the x-ray show up clearer, okay? So you just adjust the size should fit your mouth perfectly. So if you open your mouth for me, and now bite down as hard as you can, okay, just for a few seconds. Okay, just hold it there. Right, that's lovely. Okay, we'll give it a second now to come back through, and then hopefully we can figure out what is going on, and if you need to come back again for a further appointment with us. Okay, so just going to take my gloves off while I wait, and again the information should be coming through on my iPad, so we'll just give that a second. Oh yes, the weather's totally awful, isn't it? Really awful. Okay, so let's come through on here. Yes, I can see you do have in between your teeth, like I said, there is a slight gap, and it looks like a little crack have happened, and that's where you could be getting the food lodged and could be causing some pain. So what I'll have to do, I'll have to book you in again for a fill-in, if that's okay with you. I'll have one more check around and see. I'll probably prescribe you if you've got any paracetamol at home. Okay, so we'll get you booked in for, say, this time next week. Is that okay? Okay, if it gets any worse, give us a ring and we'll try and fit you in sooner. I'm just gonna have one last check and a little scrape. I did see a little bit of, let me just sit you back a little bit more. I did see a little bit of plaque on your teeth, so I'm just gonna have another look around and have a little scrape if that's okay. Alright, so just again open your mouth wide but relax, and just gonna, obviously I will avoid the tooth that is hurting. Actually I'm going to put on, I've got some of this, it's a numbing gel, so I'll put this on and that'll help with the pain at the moment as well. Considering you have sensitivity on this side, and while I'm scraping I don't want to irritate it at all, so just gonna put some of this on your gum. Okay, so open wide, yes, just a little roller ball of gel, so that's it, open wide, and you should find this is really cool and nice, and this should deaden it a little bit. Okay, so make sure I apply enough on, okay? Just to make sure it's numbed. Yeah, it's really fast acting. I'm just gonna make sure. Okay. There we go, okay. So now with that done, I can now carry on and give your teeth just on the bottom, nothing to worry about. Just, I've seen a little bit of plaque and we don't want that to turn into anything worse. I'm sure you don't want to keep coming back unnecessarily, dear. So. Okay, yes. You're doing great. If you want a second, you can, to the side of you there's the sink as you can see, and if you want to give your mouth a little rinse, and I'll give you a second. Okay, yes, that's fine. Okay. Okay, just gonna have one little last check at the top, okay? And then I'll get that booked in for you. So on your way out, if you go to reception, and they'll give you the little print off card just so that you don't forget. Okay? So. There we go. Well, just pop these to one side. You're all looking pretty good now. So yeah, I'll get you booked in. Let me just take my gloves off for a second, and I'll just book you in, and then you can go to reception. Okay? So you're okay for the same time next week? Okay. And send that across. Okay, yes, that's gone across now. So like I said, if you go to reception, they will give you your little card, and you can also pay at reception for today. Yes, only £13 today for the checkup. Okay, so lovely to see you, and I shall see you next week at the same time. Okay, bye.